The 80-year-old female patient was diagnosed with infrarenal aortic aneurysm, which is an enlarged area in the lower part of the major vessel that supplies the blood to the body. If ruptured, this can cause life-threatening bleeding. Dr. Carlos Martin, a surgeon at the Georgetown Public Hospital, returned from studying in Canada just 1 month before he was able to do the surgery on August 27th. The patient visited the hospital for another condition when she was diagnosed. At a press conference on Tuesday, Dr. Martin explained that previously, most persons with the condition die since some cannot afford to do the surgery overseas.
The key to the management of an aneurysm is actually proactive care. Because if these aneurysms rupture, essentially there's a 90 to 95% chance of mortality. And as the CEO mentioned before, prior to this surgery, these patients were essentially just palliated. They either sent home to die, or the hospital would offer comfort measures to these patients, or who could have afforded it went overseas to get this surgery done.
Risk factors for infrarenal aortic aneurysm include prolonged smoking, age, and family history. Dr. Martin said persons are not usually screened for aortic aneurysm, but with the surgery now available in Guyana, he hopes a study can be done on the prevalence of the condition here.
What was concerning for this particular patient is the rapid growth rate over 1 year, and she was actually symptomatic in terms of abdominal pain. Now, if you're going to present with an aneurysm, your symptoms, abdominal pain, back pain, sometimes you can have limb issues because the thrombus in the aneurysm can actually be dislocated to the limbs. You can have urinary symptoms from a mass effect of the aneurysm, but the majority of the patients are asymptomatic or they have pain. This is an opportunity to do some research in terms of what is the actual incidence or prevalence of abdominal aortic aneurysms in Guyana, and so that we can make better clinical decisions.
Director of the General Surgery Department at the hospital, Narendranath Rambaran, lauded the team's work for pioneering the life-saving surgery in Guyana.
And this goes a long way in developing our overall competence and building our capacity into the future.
Chief Executive Officer at the Gphc, Brigadier Retired George Lewis, said the hospital completed 1,344 surgeries for 2020 so far. BibiKhatoon reporting for the newsroom.